ভেবেছিলাম বাংলায় বলবো, কিন্তু অন্তত একজন শুধু মহারাষ্ট্র থেকে এসছে, সে খালি হাতে ফিরে যাবে, সেটাও কেমন লাগে। কিন্তু আমার বাংলা ইংরেজি বলা অভ্যাসও নেই। যাই হোক, আমি চেষ্টা করব ইংরেজিতে বলার, তবে আমার ইংরেজি খুব সহজই হবে, আশা করি কারোর বুঝতে কোনো অসুবিধা হবে না। তো ব্যাপারটা হচ্ছে এরকম, nearly 3-4 years ago at Calcutta and in national PG student seminar held, there were different subjects and I was also invited there. In that seminar I spoke something about this, our newer research work, and after finishing I was disappointed. The president of the seminar, he said, "It is Mr. Bhattacharya's personal opinion. We do not follow it, because actually I said about that the evaluation of symptoms, what Dr. Kent said, it needs to be corrected." But that president was unwilling. He said, no, we followed cases thoroughly for several years. In future, we will also follow Dr. Kent's advice, his evaluation. So, he said, there is no need to follow Dr. Bhattacharya's research work. Now, the second incident. Nearly 6-7 years ago, now retired, one of the famous organon teachers of Calcutta, someone medical college. One day, he rang me. He said, "My mother is behaving something lunatic. Please help me do something." Because at that time I was running for availing the train. So only just hearing 3-4 symptoms, I said, "You prescribe, you give him her Alzheimer's 30. At night, when I returned home, he rang me, astonished. My mother is totally quiet and calm. How it happened?" And one day I went to see his mother. Patient was suffering from OCD, and just seeing the expression of the face, she was very, very distressed. That means depression plus OCD was there. But problem, what I thought, this famous organon teacher last several years applying allopathic medicine to his mother. Why? Famous organon teacher, he knows the evaluation of change and he failed. That's why he prescribed the allopathic medicines, the psychiatric medicines to his mother. This is the situation. Actually, that organon teacher, he knows very well the subject, homeopathic subject, but he is totally zero in psychiatry. I don't blame Dr. Kent. Actually, Dr. Kent was the first person, 100 years ago, he started this evaluation and he made a format, a structure he made. But in this 100 years, huge development of psychiatry we have noticed, especially after 1980. Great development happened in the psychiatric books, and the medicines also, newer medicines they have developed. So, it is a childlike opinion that we have followed Kent and in future we will follow Kent. 100 years ago, psychiatry, psychology was in infancy. At that time, what Dr. Kent found, now it needs to be corrected. And what he said, why our senior organon teacher said, why he was bound to give allopathic medicines to his mother? Actually, in this book, the book of Bidwell, page number 52, delusions and hallucinations, these take the place in value for, these take the second place in value for repertory work. This is the point. Actually, what is psychosis? That is delusions and hallucinations. The psychiatrist says that this delusion and hallucination, these are severe mental disorders. So, I have thought that what is severe, that must be in the first position. Dr. Kent placed it in second position. I think this is the problem. For 100 years, there are delusions and hallucinations, rubrics in our repertory, but nobody follows. Nobody follows. Only we personally and our group follow it. Because we have studied psychiatry and we know what is the weak point. There are some weak points in homeopathy, such as only a few number of female provers in our Materia Medica we have seen. Dr. Dunham pointed it that in a proving you will see only a few, very few number of female provers. Maximum number of provers are male persons. It is a weak point. Another weak point, the psychotic miasm. Actually, the mind of psychotic miasm is totally wrong. It is personality disorder. And Hahnemann said nothing about this, but it is created by the later homeopaths, that is followers of Hahnemann, that is Dr. Roberts and Dr. Allen. But it is totally wrong. If you go to psychiatry, you will see these are personality disorders. So, it is a weak point in homeopathy, and that's why there are several cases of failure in our prescriptions. I remember one case, one incident. In the Second World War, Germany, they almost acquired Egypt, and British soldiers were defeating at that time. Then the government of British government, they thought we need to be changed the chief of the army staff. At that time, chief of army staff was Mr. Vogel. he was British, and Rommel was the chief of army staff of Germany. So Rommel was a ferocious fighter, and the British were totally defeated several times. The government changed Wagner and replaced Mr. Montgomery. Montgomery observed why we are defeated. He observed that the British soldiers, they have very ancient type of firearms, etc. And the Germans, they have newer instruments. So they are that's why they are getting so much benefit. At that time, USA sent some newer instruments, that is tanks and missiles, etc. And at that time, Montgomery defeated Rommel. So, what is the inference? Change of army staff, that means British soldiers gained the British soldiers, they defeated Germany. So if we post the delusion hallucination in the first place instead of second place, we will also get very very much success in our cases. That I want to say. So, there are many delusions and hallucinations, but if we ask only one, we will get many successful cases. What is that? Persecutory delusion. This persecutory delusion, it covers 60%. That means 60% of the patients suffering, the psychotic patients, among the psychotic patients, 60% suffering from this persecutory delusion. We have to ask, do you feel that your surroundings, your relatives, your friends try to do harm to you? You ask. This only one question you ask, you will get some answer. And whenever you will get this answer, follow our research work. That means follow what the modern psychiatrists say. They say that this delusion and hallucination, they will give the prime importance. That's why several times we say about this 2-to-1 aphorism of organum. There are 5 medicines there: aconite, belladonna, hyoscyamus, stramonium and mustard. Excepting aconite, other medicines, belladonna, hyoscyamus, mustard and stramonium, these are full of delusions and hallucination symptoms. That means they are full of psychotic symptoms. So, it is so much important to us, but as we have no knowledge about psychiatry, we are neglecting this aphorism for more than 100 years. And in future also, we will see that nobody cares for it. One interesting case I must say here. The patient, aged near about 80. Last 5 months, he had edema of the feet, and gradually face also edematous, whole body gradually becoming edematous. He had red dyspnea and pleural effusion on X-ray findings, and whistling sound was also there. He had very hard stool and requires mechanical aid. This patient, one of our students' father. My student, he knows about this delusions, hallucinations, but overlook these delusions and hallucinations, especially delusions. What it was, he had great discomfort in chest. He was unable to walk a few steps. Other persons are observing, he was very much sick. Patient said, no, there is no problem. Oh, it is no problem, I can easily walk. But all of the surrounding persons, they observed that he was not walking properly, he was gasping. It is a delusional symptom, delusion well-being, like Arnica. Another person, my point, he had persecutory delusion also. There are 3-4 servants in his house, and he is very much careful about these servants. When these servants finish their job and when they go to their own house, that person, that means this patient, says, open your bag, what is in it? There is nothing. But he says, all these persons, they are destroying our property, etc. But never anything was found in any one servant's bag. That is a persecutory delusion. So, seeing this persecutory delusion and delusion of well-being. Previously, several medicines in the last 5 months he was taken. Just after taking hyothermos, within a day, within 24 hours, his stool became loose. And gradually, now after 1 month, the edema almost gone. His pleural problem, that is also gone. He is now on 50 millisievert 0.1 hyothermos. So this is the magic of homeopathy, not only the magic of homeopathy, but the magic of delusions which we ignore, and that is the research work we and our group all use these psychotic symptoms and we confidently say that patients will much better if we get some delusional symptoms or hallucination symptoms. But actually in case of case taking, we never ask about these psychotic symptoms. So we prescribe only the other symptoms over the other symptoms, ignoring the psychotic symptoms. So we where it is a curable case, gradually the case goes downward and will change. That is final.